Good. Okay, would like someone to be so kind as to, well, maybe I can actually do that. So, the first thing that you're going to do is so you've just got done doing the arms, right? Just got done doing the arms, and now we're coming up to the face. So I grab my seat, they're draped, we've done the legs, we've done the arms, and the hands. So this is the last finishing touch to the massage. So we're going to make contact just on the hand, on either shoulder, doesn't matter, or both. You can do your breaths to connect, but granted, you're probably already going to be connected to them. So you want to make sure that you don't put too much oil, if any, on your hands, because especially if you're not using jojoba, because you're going to be doing some stuff on the face. And we already have natural oil, so I actually usually don't use oil for that purpose, especially on the face. And even in the rest of the body, if I can get away with it, I won't use it. Usually have to use a little, but the natural oil on the face is really good. We have a lot of oil on our face, so we don't have to use a lot of oil at all or any. There might be some residual on your hands. That's when I do use the sanitizer or something to that effect to get that off, and then wipe my hands really well on a towel that I have before I do the massage. And what I'll do is try to avoid a lot of contact with the neck before I work on the hands, not the hands, the head and the neck. I'm looking at my fingers, and I'm saying that. Because obviously from the back routine, we have a lot of oil on the neck and the back, so that makes sense. So, you good? Okay. What we're going to do is, now I'd like somebody to read it, because it's a lot for me to do that. Want to read, Caitlin?
Apply thumbs in opposing directions from center of forehead to temple area in 3 to 4 strips. Vertical strokes from brow to hairline may be applied as well.
So the first horizontal strips are just, you could do this with your thumbs or your fingers. And I like nice, firm pressure. It doesn't have to be hard, but you're just kind of pushing the worries away. Okay, and then vertical strips you said from what?
Vertical strokes from brow to hairline may be applied as well.
You could go that way, or you could go this way. Different ways. How does that feel?
Good. Oops.
Okay, next.
Hold sinus points at medial brow. Then milk the brows from medial to lateral.
Wow, you're milking the brows. It is strange.
But it feels good, doesn't
Yeah.
it?
I bet it does.
You can put yourself to sleep if you do this to yourself.
You could go harder. Yeah. Yep.
Okay.
Circular friction at temples, and then circular friction at masseter.
And with the masseter, pay close attention. Most people in today's society are clenchers in some way, shape, or form. So sometimes people don't even know that their masseters are tight. You can usually tell because they're going to be pretty ropey. So it's like, it's kind of like rolling over like a leather jump rope. You've probably felt those leather jump ropes before. It's like rolling over like 4 or 5 of those together. but then they kind of congeal into this gel kind of, and then right where they would, where they would bite, you can usually feel that that's like a little mass, and I usually work into that a little bit. And I think it's one of those things that's kind of a unspoken appreciation, like, oh, thanks, I didn't even know about that. Okay.
Utilize thumbs to trace under cheekbone from nose to ear.
One of my favorite moves that when it comes to the face to do. I feel like if I had one move to do in the face, this might be it. I'm going to take my thumbs. From this point is a great transition. I'm just going to pick my thumbs up and start at the middle. And then just trace it. They make this wonderful shape right underneath the cheekbone. And then they come perfectly all the way down to the ear. Then I'll kind of pick up and then do that all over again. And I could change the angle with my thumb to get more pressure if I wanted to. How's that feel?
Mm-hmm.
Okay.
Pinch jawline from chin to just under ear. 1 to 2 times.
So your fingers are going to be on the bottom and your thumb is just going to be on top. All you're going to do is just kind of pick up and pinch it. Maybe a little knead. Go all the way to the jawline. Okay.
Massage all of ears with fingers and thumbs.
So I would say to do the chin one probably twice. And then the ears. Making sure I think this is best done firm. Personally. Get on the inside, don't be afraid. The ear represents I think every part of the body.
Mm-hmm. Like the foot.
And the hand.
Oh, yeah.
So it's one of those universal places where if you do a really good job, then you've hit the whole body.
And if there's some sort of jewelry, would you just avoid it?
Yeah, and go around it.
But you wouldn't just cut it out?
No.
Okay.
Mean the ear itself?
Mm-hmm.
No.
Okay.
I mean, it depends what kind of massage you're doing. I don't do a lot of ear massage. I'll do it if somebody's like comes in and I just got that heavy head feeling.
Mm-hmm.
Like I'm really just, what I would like today? I would like some head work and face work. I get that request and I'm like, cool. I don't get a lot of chance to do that. So then I'll just go to nuts on all the
Cool.
face and the head and really give them a great 25-minute massage here. And that's when I really get into it the most. Otherwise, there's not a lot of time to do a lot of time for it because I'm not in that kind of spa, place. Okay,
Alright.
next.
Apply circular friction behind ears where they attach to scalp. Be cautious of facial nerve inferior to the ear.
So this is just like any of the other circular friction we were doing anywhere else. I just kind of make sure that my finger makes contact at that junction of skin where it meets the head. And I'm just doing my friction back there and making sure that I get that skin to rub up and down. I'm not going very deep because it doesn't really take a lot of depth to relax. Good pressure.
Mm-hmm. And what nerve are they talking about?
Not
Yeah.
sure if it be one of the cranial nerves or not, to be honest with you. I'm not really, that's not my strong suit. I should probably know those better, but I don't. Okay.
Transition into scalp massage covering entire head. Turn head to one side to work the back of the head.
There's really no magic secret to this one.
Square.
Just make it firm, I think, anyway. And, get the whole thing. Use your thumbs, use your fingers. I'll get the whole top of it usually first. And then, when I transition to the underside, I'll take my hand and put it at the crux of the neck so I don't have to lift her head up. And then just pull back. And I'll usually be able to grab the hair so I don't pull the hair. And then I have access to the back. I'll do a quick turn overhead, hold it around the ear, like that. And let it sit there, and then I'll continue the massage on the back by the occiput, and then up the top of the head, or up the back of the head to the top. And I'll do that for both sides. Pressure good?
Mm-hmm.
Drape to expose the cleft side.
So, this is helpful to do, but is a step that could be skipped, technically. But, I think it would be beneficial if you did it, just to have a little bit more, access. And I would just do it from here, if I hadn't already done it. You could also take care of that part. If your room is warm or if you're using a heated table, you could have this drape when you get done with the arms. You've already done the arms and the pecs, so I would probably avoid that and want that covered because it could get cold. Because it's already, got that blood flow and it tends to get cold. Those areas tend to get cold. So that's why it's always good to cover them up, and then we have them. And the reason why I want to do a little bit better of a drape is so that we can access the scalings and the SCM all the way down to the attachment point. So I wanted a little bit of that clavicle here. Okay. Next.
Apply lubricant to neck and upper shoulder and chest. Avoid
just-
lubricating client's hair.
Used not very much, barely like a half a pump. I didn't really like the sound of a pump, but whatever. So I got one more on one hand than I did on the other. Okay,
Apply petrissage to upper traps.
so you can do this
with palms.
unilaterally or bilaterally. Okay. So you got this. This is easy. You just want to move from in to out or from out to in, but whichever way you choose, make sure that you go from insertion to origin or origin all the way to the insertion. Next.
With palm supine and wrist somewhat fixed, apply bilateral sweeping.
So that's just going to be going from medial. My wrist is somewhat fixed.